Hi there, my name is Marisana Tersini, Training Coordinator of the Newcomer Connections for Senior Caregivers project at North York Community House, also NICHE for short. This presentation is part of the program training that we provide to volunteers who wish to help us with the project and has been modified to educate people on the experience of senior caregivers. Throughout the presentations, I will be using the terms caregiver and care recipient. The word caregiver is an informal or unpaid family caregiver who looks after another person in their life, whereas care recipient refers to the person the caregiver is caring for. The agenda for today is the following. We're going to begin by discussing services provided by North York Community House, as well as the Newcomer Connections for Senior Caregivers program, followed by Caregivers in Social Isolation, Older Adults in Canada, Dementia, Elder Abuse and Prevention, Caregiver Mental Health and Wellbeing, and lastly, NCSC Volunteer Opportunities. North York Community House is a multi-service neighborhood center which has worked with newcomers in Toronto for over 27 years, many of them living in under-resourced and low-income neighborhoods. NICHE provides a range of services to help people settle when they arrive, including applications, citizenship, language training, financial literacy, and referral to resources they may need or be interested in. You're welcome to visit niche.ca to learn more. The ENRICHES Collaborative is a collaborative between 5 agencies with one common goal to reduce social isolation in caregivers aged 55 plus in Toronto. It has been funded in part by the New Horizons for Seniors program and by the Government of Canada. The partnering agencies include North York Community House, Canadian Mental Health Association, Wood Green Community Services, Alzheimer's Society of Toronto, and Mount Sinai Hospital, specifically the Reitman Research Center. Each organization is doing their own part to provide free service to caregivers with the goal of reducing isolation and connecting them to support they may need. We also have other community partners, including YEP, which is Youth Empowering Parents, and they provide intergenerational computer programming. And this program is held across the city and is quite popular, as well as Innoweave National Consulting Agency. So you can read more about the collaborative on enriches.ca. This past year, ENRICHES shared this TTC ad on Toronto subway lines. And on it, it asks that together we help support caregivers and carry it forward, especially for those who feel mostly stressed in their role, tired, and socially isolated. So moving on to the next agenda item, caregivers and social isolation. So just a little bit about our project here at North York Community House, which is NCSC. Our goal here is, since we have the added focus to work with newcomers, we also provide services to caregivers and seniors who are newcomers. What we do is provide group activities and one-to-one social mentorship, also known as friendly visiting. So we're able to match volunteers and seniors who speak similar languages. Some group activities include English conversation circles, exercise programs, computer and tablet training, and these programs happen in various schools, libraries, and community centers across the city. The most common definition and understood definition of caregiver is a person who is providing care to another person regardless of their age or condition. And isolation, this one's important to understand, is the experience of lack of connection or not being connected to meaningful social relationships or supports in the community. In our research through our program here at NICHE, social isolation can depend on whether a person feels valued by their family or people in their life, whether they feel connected or even alone in their experience, and the degree to which they experience loneliness. So it's quite subjective. Just another varying definition of a caregiver. Carers Canada defines it as someone who's looking after another who has a condition, injury, or life-threatening illness. So why are caregivers the focus of our support? According to the Change Foundation profile of family caregivers, it's estimated that 29% of people in Ontario are informal caregivers. So this totals to 3.3 million people in our province. 30% of them are over the age of 55, so they are older adults. And this number is likely larger than what we see here, because not everyone will say that they're looking after someone. They think that they're just trying to help, or it is in their nature to assume this role, and it's part of their responsibility, especially in family life. Understanding the caregiver profile and what their experience is like is important. It can help policymakers, service providers, and the general community have more insight into just how much time and effort caregivers are putting into their role and what they're contributing to society. The Portrait of Caregivers study was published on Statistics Canada in 2012 by Mayor Sinha. Using info from the General Social Survey, some findings include that care recipients are most often senior parents. So there are older adults who are looking after their own parents, and this is a common trend in the population. Caregivers may be looking after their parents for age-related needs, followed by conditions or illnesses such as cancer, cardiovascular disease, mental illness, and lastly, Alzheimer's disease and dementia. And these are the most common. About 1 in 10 of all caregivers spend more than 30 hours a week providing support. And one stat I would like to bring more attention to is that 89% of all caregivers have said that their responsibility has been going on for at least 1 year longer, with half of them 4 years or more. So we can begin to see this person, this caregiver as a whole, and really get a sense of what they're contributing to society. Who are caregivers caring for? So out of these national statistics that we've just looked at, research studies and caregivers we have met through our programs, many people being cared for include the elderly or parents, friends, grandchildren, even neighbors or acquaintances in a person's apartment building, children, siblings, spouses, and the list can go on. These care receivers can live in the same home, but not necessarily. They can live out of the home or even in a facility such as a long-term care home. What's important is to understand the diversity of caregivers. So no one experience is the same. All experiences are different. There's just one constant, that people are putting their time and effort into helping another person. And the risk becomes isolation, and we'd like to know whether or not people are getting the support they need, or do they know where to get extra help for their caregiving role. What is social isolation? So oftentimes when we ask this question through our program, or even when we reflect on it ourselves, we think, okay, maybe it's just when someone's alone, or someone who separates themselves purposefully from the rest of society. But we also have to be mindful that some people choose to be alone, or prefer it that way, to live independently, have their own space, and maybe be less connected than the average person. It just varies. The risk of isolation varies, and how willing this person might be to accept help. So as mentioned earlier, social isolation refers to the lack of connectedness and access to supports, but not by choice. There may be many reasons as to why a person may be isolated, and these reasons include, but are not limited to, mobility issues and health concerns. So are they physically or cognitively able to leave their home safely? Challenges with transportation. Do they live far from a service? Is transportation easily accessible? Can they afford a car or using public transit? And do they still have their driver's license? Little to no knowledge of services or how to navigate the system. Family and friends live too far or are unavailable to provide help. Limited access or knowledge with technology. And lastly, cultural and language barriers. So these reasons can prevent or even discourage a person from getting support. The following is a model created by the Reitman Center, the Cyril and Dorothy, Joel and Jill Reitman Center, as part of their ICU framework presentation. It helps us understand the relationship between isolation and caregiver burden. So caregiving in itself is isolating and can become a contributing factor to caregiver burden or overwhelming stress as a person that finds themselves in this role. So the higher the stress, the more likely a person can become isolated. The risk here and biggest concern is that the caregiver can become caught up in this cycle and possibly develop poor physical and or mental health. Why is isolation and burden an issue? According to the Cyril and Dorothy, Joel and Jill Reitman Center, isolation results in a reduced quality of life, loneliness, a reduced social contact, so this can be with family, friends, or outside people, poor health, maladaptive behavior, how are people coping with this role, and depressed mood. There are also risk factors strongly connected to social isolation, specifically in caregivers. And this includes social factors such as shame or guilt, so having to leave the care recipient to take time for themselves, or even not to share the fact that they are a caregiver and that the care recipient lives with a certain condition, so they're not sharing this information. Life transition, so just changes in their life, health decline, aging needs, and even economic reasons. These models also help us visualize the kind of path a caregiver may find themselves in, a reality for many people. So as we can see here, depression and isolation can lead to impaired self-care and habits and a decline in overall health. Now we're moving on to the next agenda item, which is the experience of older adults in Canada. So according to Statistics Canada, the number of seniors in Canada continues to increase. The 2016 census said that there are 5.9 million seniors in Canada, which is roughly 17% of all Canadians. So as you may know, 2016 marked the first time that there were more seniors than children aged 14 and under. And this proportion will only continue to increase, as you can see here on the graphs, as we move forward to 2030. What does this mean for caregivers? So as people age, likely the number of older adult caregivers will increase, as will the number of seniors needing care. So it's important to understand these trends and in these age groups and also groups of individuals so that programs and services can address their needs appropriately. That way they're getting effective quality service and that they feel that they've been helped and in the right way. Although people are living longer, we also have to consider the quality of life and health challenges as well. So it doesn't necessarily mean that people are feeling well just because they're living longer. Here we have data developed by the Canadian Cancer Registry, a chronic disease and injury indicator framework. So it displays common health challenges experienced by Canadians, and you can see in the columns colored light green and teal what older adults are experiencing. So illnesses such as cancer, asthma, diabetes, COPD, which is lung disease or chronic bronchitis, and more conditions. Nearly 1 in 8 of Canadians who are seniors have at least 2 of these 4 major chronic diseases. So this information is relevant to the aging population who may be care recipients, and also for caregivers themselves. So this high prevalence of multi-morbidity is important to understand. Moving on, a bit more about Canadian seniors is self-reported health. And this is also important to study because although people are living with multi-morbidities and conditions, it also matters how people are feeling and how seniors are viewing their own health. The World Health Organization defines good health as not only the absence of illness, but a complete state of physical, mental, and social well-being. In 2009, Statistics Canada said that 56% of seniors reported being in good health. So this is a fairly good number considering the number of conditions that we know about and what people are living with. So also a third of Canadians have a disability. So with that in mind, there's also an increase in the number of people caring for someone with a disability. So we can see that there's always this caregiver and care recipient concept or reality for people here in Canada. Some caregivers are also sandwiched, meaning they may be providing for their children who live with a disability, or generally caring for their children and their parents concurrently. The leading cause of injury for older adults is falls, including tripping, falling on stairs, or off of furniture. So for seniors in Ontario in 1 year, there were over 100,000 emergency department visits as a result of falls. So it's not only the falls that are an issue, but people are injuring themselves. And what does this mean for the system? And what does it mean on the individual? Because it can lead to poor mobility moving forward, an overall lower quality of life. And it also puts a person at risk of death. Physical activity, quality care, and safe living spaces, and even public spaces are things that can be important for preventing falls and injury in seniors. Our next agenda item is dementia. So dementia, according to the Alzheimer's Society of Toronto, is a syndrome that causes a serious loss of cognitive ability beyond that of signs of aging. So it's a set of symptoms which include loss of memory, understanding, judgment, and reasoning. It can impact one's mood, behaviors, and abilities, and as well as the person's family and those around them. Sometimes people confuse someone being forgetful or having strong feelings of depression or delirium with dementia. So it's important to understand these symptoms. And as we see here, there's 5 different types of dementia. So it's an umbrella term that includes these symptoms. With Alzheimer's disease as the main type of dementia, it is degenerative and the most common, accounting for 64% of all dementias in Canada. Researchers are not entirely certain about the cause. However, there is evidence of plaque buildup and dying nerve cells in the brain. So there are obvious signs of changes in a brain with a person living with dementia. Common signs and symptoms of the disease include memory loss or problems with language or disorientation of time and place, as well as judgment. So if a person has a goal in mind to cross the street and they live with dementia, they might not remember to look for cars and pay attention to what's happening on the street. So they might just want to move forward and continue with what they wanted to do, like go across the street. And another can be changes in personality as well. So it can be the same person who just lives with the condition, but their behavior and thoughts and actions might be different. It's important to educate ourselves on these conditions. It can inform us on things to expect, how to work with a person living with the condition, and how to work with their families as well. And understanding more about it can also reduce stigma. Moving on to our next agenda item, elder abuse and prevention. The World Health Organization in 2007 has defined elder abuse as any action, so something you are doing, or any inaction, something you fail to do or not doing, that causes harm to an older person. And this often happens in relationships where there's an expectation of trust. So what are our rights as we age? It's our right to be free from ageism and stereotyping. It's also our right to be able to make decisions about our life to the full extent of our capacity. And it's also our right to be free from abuse and, of all kinds, including neglect. So there are a few types of abuse, as we can see here. Financial, which is the most commonly reported form of abuse. There's neglect. So this can be also unintentional, but it's failing to provide or offering support to a person, or helping with medication, or accompanying someone to an appointment because they cannot go on their own. So things like this, where their basic needs are compromised. There's also physical abuse, sexual abuse, a denial of rights. And lastly, emotional abuse, which often finds it which is often found in the other types of abuse as well. In Ontario, it's estimated that between 4 and 10% of seniors are facing some type of abuse. And this can also occur when seniors are not mentally capable and where people are being taken advantage of. So it is quite sad and disappointing to see these statistics, but it is important to recognize the signs and symptoms of elder abuse. So things that we might see in seniors are they might withdraw socially, they might have unexplained physical injury or bruises that cannot be explained, especially around wrists or in any location on the body, lack of food, poor hygiene, and things like this as well. So how can we help a person who might be abused? So one good thing to do is let them know you are concerned. Ask them what's making them concerned, what can help them, assist them with reaching out to appropriate supports, and we can also empower them to educate them on their rights as well. So if we move on, we can see here a list of community resources that I've put together for seniors who may be experiencing abuse, or even if people have questions about a situation they're uncertain about, you know, and when you have that feeling in your gut that something's just not right, we want to make sure that people and seniors have the opportunity to live safe in our communities. And even for caregivers, if they want extra support with their role, these are all resources which can help people in the community to create a strong and safe community for seniors to live in. The next agenda item is caregiver mental health and well-being. In the next few slides, we'll look at mental health as a factor of caregiver stress. Sometimes we say, oh, that person has mental health But what we actually mean is that they have a mental health illness or live with a challenge. So there is a clear, distinct difference between it. Mental health is a state of well-being. It's not just the absence of an illness, but it's having a healthy balance between our emotions, feelings, and thoughts. And I enjoy what it says here, that mental health is a state of balance that involves the self. So you have to feel it internally, and others, as well as the environment. So it's when you feel mentally healthy and strong. So mental health, all people have mental health, and illnesses affect many of us. The statistic is that 33% of Canadians experience a mental health issue in their lifetime. As a result, there's an increase in the number of caregivers supporting those individuals, also absence at work, and non-accidental death, where people can become more at risk of suicide or suicidal ideation, particularly in many young Canadians. So one issue specifically is that 2/3 of people are not getting the help that they need or not seeking medical attention. And this could be for a variety of reasons. So the first can be discrimination or fear of being discriminated against as a result of a person's age or status or what language they speak, how they identify. Also, if a person has had a previous bad experience seeking help, they might not feel encouraged to go again, or they feel that they were not understood and feel that, you know, it's their issue to take on themselves. There's also fear and shame as well, and an inaccessible system for some people. Other individuals have identified that they do not accept the idea of help. And traditionally in their family, it's something that's just kept within the family. Some of these impacts of caregiver stress can lead to mental health concerns, which in turn negatively affects the caregiver's health and the quality of care that the care recipient is getting. So as we can see here, physical health can be compromised where a caregiver might have increased illness, might feel isolated, develop unhealthy coping behaviors, may rely on more medication and having to visit the doctor more often, as well as poor hygiene, sleep, and nutrition intake. Some psychological impacts include depression, coping by using substances, anger, feelings of anxiety, sadness, and guilt. It's important to be able to identify these impacts, and any of us who may take on the role as a caregiver, or even the people that we know and the clients that we may serve. Volunteering with Newcomer Connections for senior caregivers. So there's a mutual benefit when working with older adults, as it provides us an opportunity to learn new skills and feel a sense of purpose. With the growth in the number of seniors, it also gives you a chance to understand the impacts of aging in our society. So how is NCSC supporting caregivers, and how can volunteers help? So our programs include social mentorship matching, group activities, as well as outreach and identification of caregivers. Through the program, some of the benefits caregivers have shared entering our program is being able to share their experience with people who are going through the exact same situation or a similar experience, having someone to speak to, and also learning new things. This includes English language practice and tablet training from volunteers in the community. What volunteers have told us is they benefit through this experience. They find it rewarding that they spend their time with people who might be feeling isolated and lonely, and they're given the opportunity to share their skills. Volunteers and caregivers also learn from one another and develop healthy rapport as time goes on. Now, what has the program done for caregivers through our project as well as the care recipients? Caregivers could potentially feel less isolated and have more increased access to supports or knowledge of supports and how to navigate the system, increased engagement in meaningful activities, and a better sense of a quality of life. Care recipients might have better sustained care, a better preserved relationship with the caregiver, and may be potentially able to stay longer at home. I would like to thank you for your time and interest in learning about caregivers and social isolation, particularly in Canada. We hope you have gained some insight as to what their experience may be like and the resources available to support them. If you have any questions or comments on this presentation or any interest in our programs, you're welcome to contact North York Community House. Cheers.